approach. We're protecting both lives and we're protecting livelihoods. We've bent the curve down and kept effective health measures in place to protect Albertans. At the same time, we are following a four-step path forward, and it shows Albertans that there is hope and that we're not keeping restrictions in place one day longer than is absolutely necessary. Today, the Cabinet COVID Committee met to discuss a potential move into Step 3 of our Path Forward plan. Now, since it was released in January, the Path Forward has been clear and it has been transparent. The details are posted on our website. Step 3 would see restrictions relaxed on places of worship and adult and youth team sports. It would reopen museums, movie theaters, and art galleries, along with zoos, casinos, and bingo halls. And finally, it would allow private indoor social gatherings with restrictions. And this is a significant step that would touch every part of our province. It would also create new opportunities for the virus to spread in our communities. And that is why, when we announced the plan in January, we were clear. Moving to Step 3 can be considered only when hospitalizations for COVID patients are under 300 and declining. Hospitalizations must be on a clear downward trajectory if we are to enter any new step, just like they were when we entered Steps 1 and Step 2 earlier this year. Today, while hospitalizations are indeed below 300, they've risen in recent days. The decline that we saw in January and early February has stopped. Alberta now sits at 280 COVID hospitalizations, which is a rise of 16 from a week ago. And this is a problem and a warning sign that we must take seriously. In fact, based on transmission rates in the province, we expect to have 300 people in hospital, most likely within a week. And that's why we decided not to move to Step 3 of our Path Forward plan today. There will be no easing of any restrictions at this time. This is the safe move, it's the smart move to make for our province right now, and it's absolutely necessary to help us avoid a third wave that would take more lives and once again put more pressure on the hospital system. This pause is prudent and it's essential, but I know that for many people it's a disappointment. The weather is warming up and we're all tired of the pandemic and the restrictions on our businesses and the restrictions on our activities. Most of all, I know that Albertans are tired of having to worry about this virus and the risk to their families and to their loved ones and wondering when life will get back to normal. But the reality is that given recent case numbers and the number of people in hospital due to COVID is likely to go back over the 300 threshold in the next week. So it would be irresponsible and unfair to Albertans to ease measures now only to reinstate them a few days later. The path forward is about taking our time to make good decisions based on the evidence. And until today, we had seen 7 straight days of growth in the number of people in hospitals. And that hasn't happened since we had 40 days of increases that began October 30th. That was the start of the second wave. Vaccinations are the path out of the pandemic, but the fact is, they didn't start coming fast enough or in large enough amounts. Currently, almost half of those who are hospitalized and almost 90% of those who are in an ICU are 65 and under. So I'll say that again. Half of those who are in a hospital bed for COVID are under the age of 65, and almost 90% of those in an ICU for COVID are under 65. Most of them wouldn't be there if they had been vaccinated at this time. The fact is, we simply haven't received enough vaccines from the federal government to fully protect those who are most likely to end up in a hospital. We've also seen increases in both our active as well as in our new daily cases. The positivity rate is also increasing in all 5 of our zones, which is another concerning sign. Our cases are rising and the spread is increasing. Last week, the reproductive rate, or the R value, for our province was 1.14. Anything above 1 means that cases are growing. And in Calgary, the R value was 1.23, while Edmonton's R value was 1.13, and the rest of Alberta averaged at 1.05. But perhaps the biggest issue is that the number of variants of concern is also rising as well in the province. Now, these variants, they now account for 16% of our active cases, and that's up from 10% just a couple of weeks ago. And this is not the direction that we want to be heading in as a province. We saw in November, as well as in December, what can happen if things get out of control and just how quickly that can happen. Obviously, we now have vaccines in our corner and Alberta's rollout is picking up speed. This week, Alberta will begin the final stages of Phase 2A of our vaccination program, which is offering it to everybody who is aged 65 and older. And this is remarkable progress based on our supply, and it puts us well ahead of most other provinces. And we expect to announce the start of Phase 2B, giving it to everyone with serious underlying health conditions very soon. I know that many families are patiently waiting their turn to protect vulnerable loved ones from this virus, but they're having to wait longer than they should. And the hard truth is that we would not be in this situation if Ottawa had delivered the doses and not left us waiting at the back of the line. Today, the U.S. has administered 37 doses for every 100 people. In Canada, we're only giving out about 10. It's 37 doses per 100,000, I think, for folks in the United States. And in Canada, we're giving out about 10. Had Ottawa procured vaccine on the same level as the United States or many other countries, we would have been seeing Albertans immunized 2 or even 3 times as many people right now as we are seeing in Alberta. And we would be open and getting ready to ease things even further instead of being in the situation that we face today, with hospitalizations rising and restrictions staying in place. Since the start of the pandemic, provinces have worked to limit spread while Ottawa failed to procure the vaccines. Alberta has held up our end of the bargain. Ottawa didn't. However, we won't quit. We've administered nearly 490,000 doses, and there are over 70,000 appointments already booked for this week. And the rollout will only grow. We'll keep on expanding Alberta's vaccination program and getting doses into the arms of Albertans as soon as we receive the vaccines. And we'll keep on closely monitoring our hospitalization trends and other COVID-19 numbers. When, not if, hospitalizations level off and they start to decline, we'll be ready to keep safely easing our public health measures. Spring is here, brighter days are coming, and they're coming soon. We just need to hold fast for a little while longer. We need to stay the course and to keep abiding by the public health measures that can slow the spread of COVID-19 in our province. So please pay close attention to updates on our vaccination rollout. And when it's your turn, please sign up for your shot, show up for your appointment, and follow up with your second dose. The more people who do this, the faster we can all get back to normal with our daily routines. And so thank you. I'll now invite Dr. Hinshaw to provide today's COVID-19 report. Thank you.
Thank you, Minister, and good afternoon, everyone. As you heard, we have administered almost 488,000 doses of vaccine in our province. Over the last 24 hours, we have identified 456 new cases of COVID-19 and completed about 7,500 tests. This puts our positivity rate at about 6.1%. We have identified 110 new cases of the variants of concern, which represent about 16% of all of our active cases. There are currently active alerts or outbreaks in 339 schools, or about 14% of all the schools in the province. Currently, these schools have a combined total of 1,474 cases since January 11th. As the Minister mentioned, there are currently 280 people in hospital for treatment for COVID-19, including 48 in the ICU. Sadly, I must announce that 5 new deaths were reported to Alberta Health in the last 24 hours. My thoughts are with anyone mourning the loss of someone they loved from COVID-19 or from any other cause. This has been a long pandemic, and I know that many people will have mixed reactions to the decision to delay Step 3. I have put a great deal of thought into the message that I want to give Albertans today. It is important that every one of us understands the powers that our actions have, and how crucial it is that we all make choices that protect our communities over the coming weeks. I said on Thursday that it might be possible to consider appealing to Albertans who are currently not following public health measures by offering them a lower risk way of gathering. Unfortunately, as we have seen cases, variants, and hospitalizations continue to rise in recent days, we cannot take the risk of easing any measures at this point. Now is not the time to abandon tried and true practices that have protected our communities and our healthcare system over the past year. COVID-19 is still very much with us. For those who would say that even 300 cases in hospital is just a fraction of our acute care capacity, I would remind us all of our experience in November when cases and hospitalizations began to grow sharply. Every 2 weeks from mid-November to late December, the number of people needing hospital care for COVID-19 grew. It grew by 200 to 250 people every 2 weeks, going from 270 people in hospital on November 12th to 927 just 6 weeks later. The reality is that once we hit a growth phase of this virus, our numbers will not stand still. That's why we all need to continue doing our part to not only follow the letter of the law and the public health orders, but the spirit of them as well. While immunizations will eventually protect those who are most vulnerable, we are not yet at a point where we have protected this whole group. As the Minister mentioned, 88% of those in ICU right now because of COVID-19 are younger than 65 years of age. Our current immunization program has not yet moved to offer vaccine to those under 65 with high-risk conditions, and even after receiving vaccine, it takes about 2 weeks for the shot to provide protection. We are in a challenging but hopeful time. Spring is officially here, the snow is almost gone, and warmer weather opens up many opportunities to get out of our houses, to stay active, and safely gathering with friends and family. In a few months, with widespread immunization, we will be in a very different place and able to enjoy many of the elements of our lives that we have had to put on hold because of COVID-19. But until we get there, it is more important than ever that we keep cases low. The rules in place, whatever they may be, are only as good as the steps all of us take, day in and day out, to follow them. Looking for loopholes or thinking that it doesn't matter if you bend an inconvenient rule just a little bit jeopardizes the progress that we have all made together. Our vigilance in minimizing the number of people we come into contact with each day, physical distancing, wearing a mask, and staying home and getting tested if we feel even slightly unwell are all crucial to stopping the spread of the virus. Though it may be hard to see it, our choices have immense power, and each of us has a say in whether cases rise or fall in the days and weeks ahead. I urge all Albertans to make the best possible choices they can to prevent cases from rising and to keep each other safe from this virus. Thank you, and I'm happy to take questions.
A minor point of clarification before we go to the phone. The United States has administered approximately 37 doses of COVID-19 vaccine per 100 people. Canada has administered approximately 10.5.
Thank you, Tom. Thanks for clarifying that.
Operator, could you put through the first caller, please? Operator, are you there?
Sorry, the first question is Jeff Slack with 660. Go ahead, Jeff.
Hi there. This question is for the Minister. If COVID-19 numbers continue to increase this week, will we need to move backwards into phase 1?
Great question, Jeff. As we've said all along throughout the path forward, that the path forward is about easing measures, and whether there might be the need to impose further measures, we would do as we've done throughout the pandemic, that we would look at where there might be transmission in the community, what the reasons for transmission might be, and to try to develop targeted measures regarding those types of activities. So we'll continue to look at the evidence and make sure that the decisions we make, if there is ever a need to impose further measures for the remainder of our response to the pandemic based on that evidence.
Is there a follow-up, Jeff?
Yeah, the spread of the virus continues to be an issue in younger adults, with the majority of cases found in those 20 to 39. Now, is there any plan to start giving the vaccine out to this age group sooner to help deal with rising cases?
There isn't, and the reason is because our focus is on making sure that the priority groups are folks who are the most vulnerable of a severe outcome, like death or hospitalization, that our focus is going to continue to be making sure that we don't have the pressures on our healthcare system. And that was the reason for the layered and broader measures that we imposed in November and December. Now, we do know that spread among younger people can lead to spread among people who are vulnerable to a severe outcome. But look, we want everybody to be able to get the vaccine as soon as possible. The difficulty is, again, in the supply. And if we are having a limited supply from the federal government, we have to take that limited supply and provide it to the people who are the most vulnerable at this time. But from the allocations that we're estimating from the National Operations Center right now for the 3 vaccines that currently were being provided here in Alberta, that we expect by the end of Q2 that every adult Albertan would be able to get their first dose by the end of June. Thanks, Jeff.
Operator, could you put through the next caller, please?
Next is Kevin Nimick with CTV. Go ahead, Kevin.
Hi there. Question for the minister, just following up on Jeff Flack's question. What specifically would you have to see to move Alberta back to step 1 of the reopening plan?
Sure, Kevin. Happy to answer this again. So it's not about moving back a step. It's about looking where there might be growth in numbers and where the transmission might be. And so whether there is growth in a certain type of activity, then there might be, and it might be in a geographic basis. It might be the province as a whole. So it's not us going back to a step 1. As we said, easing the measures would be on the step 1, 2, 3, and 4 process for the Path Forward plan, but that imposing measures would not be about stepping back a step, but looking at the data and making decisions about imposing measures that were based on the data and the recommendations that we end up receiving from the public health officials.
Is there a follow-up, Kevin?
Yeah, Minister, can you be more specific? Are you suggesting a regional approach to rolling back some restrictions in some areas and not others, or what are you saying when you say we need to look at the specific data?
Well, I'm not talking, well, it could be by a geographic approach, but I'm thinking more specifically, Kevin, it's not about all of the measures that might be included in a step. It might be just certain measures that are targeting a specific activity where we might see the cause of increased growth in the community. So it's about looking at the data and where we see the cause of growth. If we, for example, saw it in that specific activity, there might be the imposition of further restrictions related to that activity. But again, this is getting the advice and the recommendations from our public health officials, including those who are in Dr. Hinshaw's office.
Operator, could you put through the next caller, please?
Next is James Keller with the Globe and Mail. Go ahead, James.
Hi, Dr. Hinshaw. What percentage of new cases, I know we've got the 60% for all active cases, and there's a bit of a lag there because that includes cases that were diagnosed as long as 2 weeks ago. So what percentage of new cases involve these variants of concern, and do you expect them to eventually become the dominant version of COVID in Alberta? And if so, when do you think that might happen?
The most recent data that I've seen, and as you know, there's a little bit of a lag between when a COVID case is identified and when the screening is completed. So the most recent complete days of testing where we've run all those screens, and again, the lab is doing a great job to try to shorten that window. We are sitting at around 20 to 25% of our new cases as the variant. Now that does fluctuate a little bit day to day. But I think what we've seen in other countries is that because the variant is more transmissible, that it eventually does become the dominant strain where there is spread in the community. It's hard to say when exactly that might happen, and it's present, I would say, in different proportions in different parts of the province. But the important thing for all Albertans to know is that the only way that we're going to be able to slow the growth overall, but particularly with the variant cases, is to follow the public health measures every day in every activity we do, because what we are seeing is that the variant is spreading widely in locations where people are not following the public health measures and where they've let their guard down, and that variant takes the opportunity to spread very quickly from one to many. And we are seeing that there can be multiple generations of transmission even within 1 week. So within several days of an exposure, people are infectious and passing it on to other people, which means we need to make sure that all of us regularly are thinking as we're going about our daily activities, what are the things that I need to do every day and every moment to make sure that if I am in the presence of somebody who may be infectious, that I won't pick it up, or if I happen to be infectious, that I won't pass it along.
Is there a follow-up, James?
Definitely, yeah. And this is more for Minister Shandro, I think. In terms of the benchmarks and focusing on hospitalization, we've had to delay these steps twice because, as we're seeing, hospitalization numbers on their own don't tell you enough about what's happening now in the community. So do you think the hospitalization, so the focus on that, was a mistake? And do you need to revise the plan, even if it's just to make this easier to communicate to Albertans? Because we get into this point where people see that we're under a certain threshold and get really frustrated that we're not moving forward when, as you're discovering, there's not really enough information on its own to make these decisions.
Thanks. Not at all. This is the Path Forward plan doing exactly what it was designed to do for us to be able to look at our hospitalizations, but also giving us a window to be able to look at how the easing of any measures might affect growth in our community, and as well to make sure that we knew that cases can go up and they can go down, and hospitalizations can go up and go down, that as we go through the Path Forward plan, looking at whether hospitalizations are declining. And that's exactly why we included those 3-week windows in between each of these steps, so that we could continue to look at that data and that evidence to be able to make the decisions about whether or not to continue with the next step.
All right, we've got time for 2 more callers. Operator, could you put through the next one, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, I think this question is for the minister, but if Dr. Hinshaw wants to answer as well, that'd be great. When will the province be taking another look at moving into step 3, and what do you have to say to businesses that continue to wait to reopen?
Well, I'll answer the second question first. So we understand the frustration, and we understand the frustration of not just the business owners, but all Albertans, and how public health measures are affecting our activities, affecting our businesses. We have an incredible amount of sympathy and empathy for everybody who is frustrated with these measures, and looking forward to not just the light at the end of the tunnel, but the end of the tunnel, and us being able to get back to normal life. So we appreciate that. We will continue to look at whether the hospitalizations today went down from 282 to 280, whether that's a trend that continues, or whether it was we continue to see increases in hospitalizations. We'll continue to look at our case numbers as well, and the percentage of our new data cases that are variants of concern, and being able to judge all of those measures, including the positivity rates in the zones, the R values, and being able to look at whether and when we can have further easing of measures in the days to come.
Is there a follow-up, Julia?
Yeah, just a clarification. So it sounds like you'll just be real-time tracking how the numbers go. So to be clear, there isn't a date 2 weeks from now where things will be reassessed? I'm just hoping you can clear that up for me.
No, there isn't a specific date that we're going to hold ourselves to. We'll continue to, knowing that right now we are at 280, and once we see declining hospitalizations, then it is something that we could consider to moving forward with a step 3. But right now, knowing that we had 7 days of increases in our hospitalizations, we do see a setback with increasing numbers in our daily cases. That the prudent and safe thing to do is for us to be able to hold off on proceeding with step 3, continue to monitor the situation, and move forward to step 3 when it is prudent and safe for us to do so.
Operator, could you put through our final caller, please?
Final question is Lauren Boothby with the Edmonton Journal. Go ahead, Lauren.
Hi, this question is for Dr. Hinshaw. I'm wondering if you can tell us where we're thinking these rising cases are coming from. Are these connected to any particular venues or anything connected to reopening in step 2?
We're seeing, as we have for some time, a few different trends. One is spread within households, particularly with the variants of concern and the B117, which is the one that we have the most of in Alberta. When an individual is sick or infectious with that, they transmit very easily within the household. So we are, as we have been for quite some time, seeing a lot of transmission within the households. And so I would remind people that if anyone is exposed to COVID-19 and is living in a house with other people where they can't effectively isolate or quarantine away from them, there is the Alberta Isolation Hotel program, and that is explicitly for those who have that difficulty and provides the opportunity to safely quarantine or isolate outside of a household so as to not put others at risk. We are also seeing trends of social gatherings, and so again, recognizing that it has been extremely frustrating in a very, very long time that people have gone without seeing family and friends in indoor social gatherings, recognizing that over the Christmas season, Albertans were one of the best performing groups in the country when it came to making sure they were protecting their communities by not having those social gatherings. We need to get back to that just for the next little while, again, because we know that social gatherings are driving spread. And we're seeing, again, very rapid spread from one to many when people are in situations where the public health measures are not being followed.
Is there a follow-up, Lauren?
Yes, just for Dr. Hinshaw, if you can just explain the social gatherings having cases, is that outside? Also, you didn't answer the question about if cases are tied to things reopening. What do we know about cases that are tied to things that had restrictions eased during the last stage?
So again, I don't have the most recent specifics of the percentages. I could tell you specific instances that have been shared with me where, again, it doesn't matter what context someone is in. If we let our guard down, the virus can spread quickly from one to many. So we have seen, for example, very rapid spread in some restaurants where individuals had the variant, were infectious, went to multiple restaurants and spread the virus very quickly in multiple locations in one night. Or, for example, again, where people who were infectious attended a workplace, and again, the guard was let down and the virus spread rapidly. So I wouldn't say there's any one particular context where all of our spread is happening. The common thread between all of this spread does seem to be, again, people are tired of the measures, letting their guard down, and just, again, it can happen very quickly if we let our guard down. Even for a few minutes, it can cause transmission if someone's present who's infectious. And I'm sorry, what was the other question?
Just about if cases, I think I just asked if the cases were connected to any restrictions that were eased, but you kind of answered that. Do you have any information about cases being connected more so to any other steps that were part of things that were open in step 2?
Again, I wouldn't say that it's a particular location. It seems to be the trend that wherever people are, whether it's their own workplace, whether it's a location where they're engaging in recreation, or again at a restaurant, it really, the common thread is when we let our guard down, the virus spreads quickly, whatever setting we happen to be in. So I think, again, the message that we all need to take to heart is for ourselves, and also to encourage those around us, that if we let the virus spread rapidly at this point in time, it's not going to, the vaccines can't catch up. So if the virus spreads right now, offering vaccine after the fact isn't going to protect people who've become infected and ended up in hospital. So we need to hold on a little while longer. We need to protect our communities and give ourselves time to get vaccines on board, those who are at the highest risk.
Thank you all for joining us tonight. Dr. Hinshaw will provide another update on Wednesday afternoon. Have a safe evening.
Thank you.